Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them faster than you can flip your phone. This episode delves into other Picornaviruses important to human disease. Challenge yourselves with these questions before we start. Which Picornavirus cannot survive stomach acid? What is the primary mode of transmission for Parechoviruses? Let's dive in. Picornaviruses have positive sense single-stranded RNA as their genetic material, ready to be translated by host ribosomes. Their capsid, or protein shell, is icosahedral, giving them a sturdy, symmetrical shape. They lack a lipid envelope, so they're invulnerable to detergents and drying. Most are acid-stable, like Parechovirus, but Rhinovirus is fragile at low pH, so they don't survive in stomach acid. Parechoviruses break open cells with their capsid and can target the central nervous system in at-risk individuals. They spread mainly through the fecal-oral route. Other possible transmission methods include exposure to respiratory droplets and transfer from mother to baby through the placenta, breast milk, or other body fluids. Newborns and young infants are most at risk of serious illness. Parechovirus symptoms usually start 3 to 7 days after exposure. During the first week, most infants have mild fever, rash, breathing problems, or gastrointestinal symptoms such as poor feeding, vomiting, diarrhea, or abdominal swelling. Newborns are highly at risk for complications. In severe cases, Parechovirus infection can involve various organs, even the brain and its cover. Brain regions that may be affected include the cortex and brainstem, but the cerebellum is usually spared. Seizures and lethargy may be seen during the acute phase. Delays in cognitive, motor, or language skills, as well as behavioral issues, are possible long-term complications. Next is the rhinovirus. A key virulence factor of these viruses is their capsid variation, with over 100 different types, which helps them evade immunity. They grow best in the cooler temperatures of the upper airway, around 33 degrees Celsius. Rhinoviruses spread through contact with respiratory droplets or contaminated surfaces. They're not transmitted by the fecal-oral route because they don't survive stomach acid. Self-inoculation, or spreading the virus within your own body, can also occur, for example, by touching your eyes and face after coughing on your hand. People of all ages can get infected, but children and individuals living in crowded settings are most at risk. Rhinovirus infection usually starts 1 to 3 days after exposure and is self-limited, lasting about 7 to 10 days. Most people get a common cold with a runny nose, nasal congestion, sore throat, and cough. Complications can include triggering of asthma attacks, ear infections, or sinus infections. Neither Parechoviruses nor rhinoviruses have a known link to cancer. Diagnosis is most often based on clinical signs, but complete virus identification usually isn't necessary. Polymerase chain reaction may be used in severe or unusual cases, for example, in babies with seizures, to rule out infections that have specific antiviral treatments, such as herpes virus. Specimens for PCR testing include cerebrospinal fluid or blood for Parechoviruses and respiratory swabs for rhinoviruses. Treatment is supportive for both viruses. Rest, fever control, and fluids suffice for most patients. But infants showing severe Parechovirus symptoms require intensive care. No antiviral is specifically recommended for either infection. Prevention of both infections relies on hand hygiene. Extra precautionary measures against Parechovirus spread in newborn care settings include isolating sick babies and careful handling of diapers and body fluids. Avoiding face touching and practicing good respiratory etiquette can curb rhinovirus transmission. Let's go back to these questions. Which Picornavirus cannot survive stomach acid? Answer: Rhinovirus. What is the primary mode of transmission for Parechoviruses? Answer: fecal-oral route. Got both? Home run! If you found this real valuable, help us grow by hitting like, share, and subscribe. Scan the summary table in the description. Thanks for watching. Hang on to Med in 5 for more med lessons in a flash.